Hey folks, Dean Gould here, and welcome to today's podcast. Today's going to be a great one because we're really going to jump into somewhat of a controversial, age-old question. And I really think we've got the perfect expert to address the question. I'm really honored to welcome Manny Asser to the podcast. And there's many people out there listening. I know that were impacted in their careers by Manny. He as a salesperson, Manny was sales rep of the year 3 times at 3 different companies. So I've said it before, Tom Brady won 7 NFL championships. Winning sales rep of the year is like winning the Super Bowl. So anybody that's done it 3 times at 3 different companies really puts you in another league, in another stratosphere. And not only that, but he was President's Club 10 years in a row, which means either he was in the top 10% or in the top 10, and he never finished below 5th in the rankings. So it's almost like us mere mortals. This is incredible. Have Manny on the call. And then, of course, he was promoted to sales manager and became division manager of the year. So for managers, again, like winning the Super Bowl, and then promoted again to supervise managers. And I had the benefit of working for for Manny when he was region director at Cordis. And I can tell you that my career and my life was highly impacted by Manny, the things that I learned from him. And he's really a straight shooter and only wanted to help all of us succeed. So he helped me rebuild a team that had been struggling for years. And we were able to bring that team to great heights and great successes and win awards. So once again, promoted into a worldwide position as training director for Cordis, where he traveled throughout the U.S., Asia, Latin America, Australia to conduct training and national sales meetings for the company. And the thing that struck me that he's most proud of is when he helped create, or he created a management development program where they took prospective managers from the sales force and put them through a 2-year program where they learned how to become great sales managers. And I can tell you that, unfortunately, many companies out there they have great sales training programs, but often lack a program to train managers. So oftentimes it's sort of sink or swim. So, and then all 12 members of that original group went on to be presidents and vice president of sales at different companies. And so really I think if you look at managers and directors and vice presidents that do well in their career, these are people like Manny who really wanted to help other people. And again, for me personally, I can't thank Manny enough. So, and that's really our goal at MedConnect 180 is what Manny did. And that's to help people achieve their goals and move forward in life. So without further ado, Manny, thank you so much for taking time out of your schedule. I know you've been helping people again in your career recruiting, and it's just an honor to have you here. And I'm sure Manny's thinking to himself, okay, Dean, stop with the BS, stop with the ass, or excuse me, the butt kiss, and let's just get down to brass tacks. So welcome, Manny.
Thank you, Dean. Thank you. I'm very honored to be here with you. Thank you for the kind words. That was very nice of you.
Yeah. So, I mean, obviously things you really did. And so, in jumping into this age-old question, Manny, the first question I wanted to ask you is, can a pharmaceutical rep transition to medical sales?
So my answer, my opinion is absolutely yes. And one proof source, Dean, that I have relates to Johnson & Johnson, where both of us spent a great deal of our career. Johnson & Johnson is a company that's somewhat decentralized. They have 250 different operating companies. I would venture to say that of those 250, it could be all of them, but I would say at least 230 of those CEOs all started their careers as pharmaceutical salesmen. So not only can a pharmaceutical sales rep transition into sales, and it's up to the individual, but sky's the limit. We can do the things that we want to do if we're willing to take the time to do the work and have the discipline. The second reason that I feel this way is this. If you look at the characteristics of highly successful sales reps, so they're organized, they're persistent, they're typically self-starters, they're competitive, they're great listeners, they understand how to build strong relationships, and they're closers. And when I say closer, it means they request actions. They request action steps from their customer. Nowhere in that description did I say they can't or they have to be pharmaceutical reps. Those are characteristics that individuals have to one extent or another. And if they have those characteristics, they can be successful in whatever it is that they want to do. So that's my answer. Is can it be done? Absolutely. There are kind of ground rules to how to break in and different techniques and tactics. And you got to be looking at the right companies. But is it possible? Heck yes.
Yeah, there's nothing you said, Manny, that I don't agree with. It's a complex question. It's sort of you started off with sort of a broad answer, and I agree with you absolutely. But there is a bias out there. There's no doubt that there's many medical device or medical sales managers that really won't even look at pharmaceutical reps. And one of the things that you mentioned in your answer was your ability to close. And I think that that is sometimes a fair and sometimes an unfair knock against pharmaceutical reps. And again, it depends on the individual. So there's this bias, and I wanted to ask you, where do you think this bias came from? And how would you explain that people have developed that bias and why maybe sometimes they need to rethink it?
Well, we are again aligned, and I appreciate your forthrightness. There is a bias, and there are generalizations that people make. And when we look at what causes those generalizations, I'm going to give you a couple of different reasons that I believe they're there. And I do think that there are times that there are accurate statements that could inhibit somebody from getting hired, no matter what their background is. But so why is that? Why do these bias take place? Well, the first thing is there's some ego involved. I know when I joined the industry, it was pretty well understood that when you want to break in, most people are going to start in pharmaceuticals. And so when I started, they said it was kind of a pecking order. There's pharmaceutical guys, there's medical device guys, and capital guys were kind of the highest echelon of sales at the time. So this creates a generalization that may or may not be true because your industry doesn't define your skill. So you could be a pharma guy and be better than any of these guys as far as being a great salesperson. So now if we get into more of the technical aspects of it, so in medical device, a lot of the sales are procedure based, and more specifically, cardiac cath lab. I spent most of my career in cardiac cath lab. They're only going to look for reps in that space that have had successful hospital sales for 5 to 7 years. They're not going to go with entry level. That's not how they do it. They want somebody that knows that procedure or has contacts, because access is very difficult. So it can get a little tricky. Now, let me jump back to pharmaceutical reps. We talk about them as they're one. Well, right out of the gate, we have two different types. You have one pharmaceutical rep who would be calling on offices, and another that has to get products through formulary into a hospital. So I think when you mention closing, I think what happens to some sales managers is they say, well, if this rep was calling on a doctor in their office, they don't really get a purchase order number. They try to get a commitment that the doctor will order it, but it's hard to measure that he really did because it goes through a distributor. And so they're paid as a division, not individually, and they're measured as a division, not necessarily individually. So it's hard. It's harder to be able to determine what the impact that person had. Some other biases are this, and this is where I do think there is some validity. Pharmaceutical industry tends to pay primarily base salary and year-end bonus. So your base is a big part of your pay, like 80, 90% in general. In the medical device business, very different. It's more like 1/3 base salary, 2/3. So here's what can happen to somebody. Let's say they're 8 years as a pharmaceutical rep, and they've been getting their base pay raises, and now their base pay is up to like $125,000. That person goes to interview for a medical device job, and they tell them, well, the base here is 80, but our guys at forecast can make $225,000. And you will get people that'll say, well, no, I need a base higher than that because that's what I'm making now. They're not wrong or right. That's how they've set themselves up. A little like someone that invests in bonds is more conservative. Someone that invests in stock is taking more risk. It is more risk to have a lower base, but you got to have the confidence in yourself that you can make it happen. But, you know, it happens. We raise our expense levels to the money that we know that's coming in, and now some people can't drop back down. So is that making sense?
Yep. Yeah, I know that early in my career, and part of the bias, when I was early in my career, and I learned from some of the best managers in the world who mentored me. And I think, you know, when you're hiring somebody, it's one of the most important things you do. And you can make your life easier, or you can make it hell, if I can use that word, by hiring the wrong people. And so you try to minimize the risk and minimize the chance that you'll hire the wrong person. So I was taught early on, don't really look at pharmaceutical reps for some of the reasons that you mentioned, that they, you know, really they go in. And again, I think both Manny and I, if I can speak for us, Manny, together, pharmaceutical sales is a very professional and incredible career. We're not saying that they bring tremendous value to the industry. You know, doctors that don't have the time to spend reading clinical data, they bring this information to physicians and have dialogue and discussions and allow the doctors sort of to decipher the conversation and sort of plant the seed and begin sort of an understanding of what new data is out there. So it's a tremendous career, but as you pointed out, there's no purchase order received. They're not closing necessarily a business, although some would argue that they're in injectable sales and they actually do get POs. But for the most part, 90% of pharmaceutical reps don't do it. But let's not forget, as you also pointed out, a lot of these reps come from a B2B background where early in their career, they were out banging on doors and getting orders. And so I was trained not to do it. I had that bias, and I wouldn't even look at a pharmaceutical reps for the first part of my career at all. I would just tell recruiters to forget it. And, you know, I think there's a lot of angst and anger out there sometimes against recruiters who, at one point in my career, I spent 2 years recruiting and learned a new appreciation and respect for recruiters and what they do. And like any salesperson, if a manager tells you, I don't want to see any pharmaceutical reps, if you keep sending them product that they're not interested in, eventually you lose a customer. So I had this bias, and I was curious if you ever possessed the bias in your award-winning management career, and if you did, what caused you to get over it?
Well, that's a great question. And I'm going to preface it by saying at Cordis, Johnson & Johnson, what we were doing, we had a program where we were getting military guys for free from the government. Now, I'll be straight up, they didn't have any experience selling. And we put them into roles where they were like associate reps, where they supported a sales rep, taught them, trained them, and a lot of those guys did well. Now, our criteria, our selection criteria at Quartus, again, was pretty much centered around, you were looking for somebody 5 years experience with selling devices and procedural devices. So you could argue that that was a bias then, because that was selection criteria that would not have included a pharmaceutical rep. Now, where we did have a chance to bring on some pharma guys were also in these roles, these sales support roles, leading to a sales job. Because you said it right, Dean, it's a big risk when we make a hire, and you don't know if someone isn't going to enjoy being in procedures all day. They think they might, but maybe they won't. And so the way we used to look at it is an employee, to define the risk a little bit that you described. And most employees, sales reps, they're going to stay, let's say, 3 to 5 years. And if the difference is them selling 3 extra stents each day, the difference between great and good, that would have been $9,000 a day. There are 300 selling days in the year. So where are we at? What you lost is $270,000 by hiring an average person versus a good one. That's in 1 year. So over the course of 3 years, you're going to be close to like 800, whatever the number is, $800,000. That's the difference. So it's very expensive to make a poor choice. Your question was, did I have it? And how did I get over it? For me, everybody was the same if I felt like they had what it takes to be a winner. But I hope this expression resonates, but you kind of have to fish in the right pond. Here's where I'm coming from. As an example, right now, Dean mentioned that in my retirement, I do some recruiting. So one of the opportunities that I have right now is with a company that sells intravascular ultrasound. The acronym is IVUS. The requirement for IVUS is that you know everything about PCI or angioplasty, because this is an advanced treatment. So you have to be able to read film, you have to be able to interpret the images and those kinds of things. And if you don't have that, as you pointed out, Dean, the manager's not going to be interested. So you do have to you have to sort of look for these companies that tend to want to hire a pharmaceutical person. First of all, they're almost always college educated, which is what we want. They're smart. They did a lot of sciences to get through their training and things like that. They usually have a good appearance. So they have a lot of the characteristics that we're going to want to see. It's the experience. So what are some spaces that lend themselves more to somebody with a pharmaceutical background? Well, one is orthopedics. They'll take entry people into the quote device side. And there are other companies that sell sutures, things like that. You get yourself started, you get a couple of years. If it's great, you keep going and keep getting yourself promoted. If it's not great, go ahead and make the next move and leverage the one before it. So it's, if the manager has that much bias and the company looks like that's what they're looking for, like when they run an ad, say in LinkedIn or whatever, and they're saying, we want 5 years experience, we want cath lab contacts, don't ignore that. Don't think that, no, I can just send it in. I don't have any of those characteristics, but I'll just send it in. It's not going to happen. So you want to make sure you're looking at the right kinds of companies to give yourself a good chance. Does that make sense?
Yeah, that's great advice for, those pharmaceutical reps that do want to make the transition. I think you're spot on. It's because I think what happens a lot of times, people make that decision and they say, well, I'm going to just reach out to 20 recruiters. And the first thing is, I'm sure you've gotten those blanket emails that reps send out to like 100 recruiters, and it's sort of irritating. And you don't want to really work with that person because you might spend a lot of energy and time as a recruiter helping somebody only to find that five other recruiters submitted their resume. There's, the loyalty works both ways. And I think as a shout out to recruiters, again, the respect I have for them, you know, there's only so much time in the day, right? I mean, you're getting thousands of resumes every day, and to personally call everyone back is impossible. So you're really, as you said, fishing in the pond of resumes and backgrounds and referrals of people that fit the criteria of the company or manager gave you. And so, again, like I said, some of the anger and frustration that people have with recruiters is, to me, unfounded, because today you may be frustrated, but once you get your break in that industry and you rise up to be a manager, you're going to want that recruiter that sort of sends you the candidates you're looking for. Any thoughts on that?
Yes, and I would say this: the fallacy, and this is back to a prior question, actually. The one fallacy and bias is that it's just easier pharmaceutical. It's not easier. It's different. It's not. If you're going to be good at it and be great at it, it's not easy. Nothing that you're going to be great at is easy. So I want to make sure that we're getting that out there to the audience, that there is a perception, false perception, that it's easier. And I'm like, yeah, well, it's easy to be average at a lot of things. If you're a top performing pharmaceutical rep, there's a reason for it. And likely you have greatness and you just are earlier in your career. And if you want to get into this other space, it's been done. It's been done routinely. On the other hand, I have seen people who say, well, it's because I had a pharma background, and maybe it wasn't. Maybe there were other reasons within the interview. So interviewing itself, first of all, you've got to really work hard on your resume and make sure you're showing your results and make sure that you can articulate your story on the logic behind why you made moves that you did and how you were successful and why you've been successful. So the resume is a big one. Is that you've got to do a good job on that, and you've got to be able to tell your story. So it's all about power of persuasion. You become the product, your resume becomes your literature, and you need to be able to sell yourself. And I wouldn't, like I said, if they're going to give you an interview, it means that they believe, they've seen your resume. It means that they believe if you do really well, they would hire you. They're not going to interview you if they just have zero interest. People don't have that kind of time anymore.
Yeah, I agree with you. And I think, if you're a top pharmaceutical rep, as you mentioned it, and you've won awards, you have a chance to, get a recruiter or get in front of a manager. And if you're a manager in pharmaceutical sales, I work with a phenomenal device manager now. He's vice president of sales of a medical device company, Chris Gleason. This guy was a manager in pharmaceuticals, so I was able to present him when I was recruiting to a manager, and he got hired with Intuitive Surgical and did an outstanding job there. But if you haven't really gotten the awards and such, I think trying to work with recruiters, and you can certainly challenge me on that, I think you're going to waste a lot of time. You're going to get really frustrated because they're, again, sales professionals as well. Recruiters are. And so you're better, I have my thoughts. What are your thoughts? Or if you could give one sort of piece of advice for a rep trying to transition, how would you say would be the best probability to to get in front of somebody to get an interview?
I would use following resources. First, I would network with people in the business that I know, other salespeople in different companies. First thing I would suggest is take out your contact list and start telling your friends that you're interested in making a move, and do they know of anything in the device space. That would be one thing I would highly recommend. I would look at LinkedIn and get myself visible on LinkedIn, and you'll start seeing jobs pop up, managers posting jobs and things like that. Now, I hear you, Dean, on the recruiter, but I would uncover every potential. I would register with not a lot, maybe one or two max recruiters, and listen to what they have to say. If a recruiter is a good one, they can help you with your resume. They can help you with best ways to answer questions, because there's a game within the game going on in an interview as far as what you think they're asking and what they're really trying to understand. And so, unfortunately, people that change jobs a lot sometimes become really great interviewers. That doesn't mean they're great salespeople. That just means that they're very experienced. And sometimes you can get a great player, and let's say they've been in the same company for, say, 7 years, never looked. They may not be great interviewers because they don't have as much experience. It doesn't mean they're lesser reps. So being able to articulate your story, having a good resume, being able to tell your story, are very important characteristics to people getting hired. And so, in terms, again, to answer your question, I would network with my contacts, people that I know. I would use LinkedIn. I would use a recruiter, and I wouldn't hesitate to try to contact some companies directly. That's usually through HR. But I mean, I would go for it all the way. You never know where your opportunity could come from.
Well, Manny, you and I did not really discuss these questions prior. I sent them to you, but we didn't discuss how we felt on the answers. And I can tell you, I'm aligned with you all the way through. Again, for me, for award-winning pharmaceutical reps or managers, a recruiter for me could be an avenue. I think it's just tough for so many to review all these resumes of pharmaceutical reps and call them all back. But to your point, you never know when an opportunity will arise, and you shouldn't sort of discount anything. But I think we had an opportunity today to hear from one of the most successful people in the industry ever. I mean, the list of awards goes on, and we're so grateful for you to spend this time as sort of an unabashed promotion or statement. I would say is one of the things on MedConnect 180, our course, we've brought on 10 industry leaders to help people understand what it takes to be a top medical sales rep. You mentioned sort of, really understanding the business and being able to answer questions. Well, understanding what it takes to be a top rep is so important. Not that you want to, as you said, be a good interviewer, but you have to sort of embrace those concepts. And we have a free guide along with some other guidebooks that we provide with getting involved with the course. But just this 30-minute discussion, Manny, is going to benefit so many people, including managers. And I want to thank you again for being on and being such an important part of my career. And I hope we can have another discussion real soon.
Thank you, Dean, and thanks for all your kind words. It's an honor and a pleasure to work together with you. And I'm going to throw in one more thing to the pharmaceutical reps, med reps. Log into med reps. You'll see a ton of medical device jobs. Anyway, thank you, Dean. Thanks for the time, and it's a pleasure to work with you. You're a class guy.
Thank you, Manny. Back at you, and we'll talk soon.
Thanks, Dean.
Bye-bye.